Today, Maine CDC gave an update on its coronavirus response. These are the three things you need to know. First up, new federal guidelines and how they relate to children. Maine CDC Director Dr. Nirav Shah said the U.S. CDC is working to make more specific language about how the guidelines apply to school students. Kids and teens younger than 16 are not eligible for a booster, which is a key component of avoiding quarantine after exposure to someone who tests positive for COVID. Dr. Shah said he's working with Department of Education Commissioner Pender Macon and superintendents at several schools to address how to apply these guidelines for the many nuanced situations regarding kids and their vaccination status.
There is a move afoot more nationally to rethink the approach to quarantine in light of increasing levels of vaccination, as well as pooled testing, which has been a success in Maine. So we're rethinking what quarantine and contact tracing look like. But we want to do so after seeking the advice and consultation, the operational input from superintendents on the ground.
Bottom line, kids under the age of 18 do not have to have the booster to avoid the quarantine period if they're a close contact. For kids younger than 16, as long as they've had both shots, they can avoid the quarantine as well if they're a close contact. But anyone, regardless of age or vaccination status, should isolate at home if they themselves test positive for COVID. Number two, the FDA said Tuesday that some at-home antigen tests may be less sensitive in detecting the Omicron variant, but the FDA did not specify which types of tests nor how much less sensitive those at-home tests are. Dr. Shah said he's not been told or seen data around which tests are less sensitive. He also said there's no recent data to show how much less effective they might be. A U.S. CDC study from almost a year ago found that Binax Now tests detected the virus in 64% of symptomatic people compared to PCR testing. Dr. Shah says these rapid antigen tests are still useful despite the FDA's new statement.
This is not if you've got a test, chuck it out. That is not what's been said. It's more of this is something that we need to study and better quantify so that maybe recommendations, if they need to change, can be done so in the future. I think it would be premature to change any guidance around the use or utility of rapid tests at this time. Something we need to watch further.
Keep in mind, the state does not get the results of at-home tests, so if you use one and you test positive, you should report it to the state so that the CDC has a more accurate picture of the spread of the virus in Maine. Now, regarding the sensitivity, Abbott, which makes the Binax Now tests, put out a statement yesterday saying, quote, "We've conducted lab analyses and tests on the Omicron variant from live virus, including from the first U.S. Omicron case. And Binax Now detected the virus in all tests we performed at equivalent sensitivity as other variants. Additionally, our data from customer use has not shown any change in test performance." Finally, masks. Maine CDC Director Dr. Nirav Shah says people should consider upgrading their masks if possible. He says he still wants to study the topic more, but he said during today's COVID briefing that it may be time to retire cloth masks. Previous studies have shown cloth masks, which do limit the spread of COVID somewhat, are less effective than surgical masks or KN95 and N95 masks. Dr. Shah says because of how transmissible the Omicron variant of COVID is, he may suggest that people use one of those if they have access to them.
As we learn more about Omicron and how quickly it can be transmitted, upgrading your mask, if you haven't done so already, is something to start thinking about.
And those are the three things you need to know from today's state CDC briefing.